COVID-19 vaccine, passport to travel. To date, over 686 million COVID-19 doses have been administered in 137 countries, sending a wave of hope that domestic and international travel might return to a pre-pandemic state sooner rather than later. This video is brought to you by HealthyRN Ways. Videos will be posted every Monday, Wednesday and Friday about COVID-19 pandemic. Please see my other videos at the end card of this video. Tourism-reliant countries, like Greece, are currently pushing for vaccine passports as a means for bolstering tourism and, in turn, economies. Will you need to carry a digital proof of COVID-19 vaccination to travel outside of the US? Experts weigh in on how vaccine passports might be implemented. What is a vaccine passport? Vaccine passports aren't exactly real passport. The phrase is how some are referring to electronic or paper proof of valid immunizations. They are not part of the usual passport process. Vaccine passports are also commonly referred to as health certificates, travel passes, or health passports. Vaccine passports would allow travelers to provide individual documentation or proof of their vaccination status, a private digital health passport platform where people can input their COVID-19 symptoms, test results, and vaccination status. How would it work? COVID PreCheck is among the various existing companies that are developing and testing vaccine passport. On COVID PreCheck's platform, travelers would input their last name, date of birth, and cell phone number. We are very careful about privacy and security. Once your personal and COVID-19 immunization information is entered, vaccination status would be verified by an electronic medical record or a physician. The user then is able to display the COVID status via smartphone, which displays a QR code. Businesses or authorities can read that QR code with a device like a smartphone or tablet. While vaccine passports have been tested by private entities such as technology and travel companies, it is unclear whether they will be accepted and rolled out globally. Israel, the country with the highest vaccination rate in the world, released their version of vaccine passport in late February. Their Green Pass, which is a paper and digital vaccination certificate, is available to anyone who has received 2 doses of the COVID-19 vaccine through Israel's health maintenance organizations or another accredited vaccination service, or has proof of previous COVID-19 infection. This passport will be used to offer access to places like hotels, gyms, theaters, restaurants, and more. Most recently, the European Union has proposed implementing a digital green certificate in a similar vein. Vaccine passports are still being developed and tested, so it's not yet known if they will be implemented in the US. If you are planning to travel domestically or internationally, you can check the state or country's COVID-19 policies on testing and vaccine requirements. Vaccine passport poses barriers. While some say that vaccine passports are a golden ticket to international travel, that they have limitations and would create barriers for those who can't access vaccines. It runs the risk of stigmatizing people nationally and internationally who can't get access to vaccination. In a recent press briefing, a senior World Health Organization official advised against the implementation of COVID-19 passports globally, citing that there are ethical considerations to instituting such a rule for travel. Having vaccine passports could run the risk that people will let their guards down during a time when scientists are still learning about the effectiveness and duration of immunity the vaccines offer. Vaccine passports may provide a false sense of security of the potential risks of transmission during air travel. Vaccines have been assessed for their efficacy in preventing severe illness and death. We are just now learning more about their ability to abate transmission. Because vaccine passport systems are mostly privatized and have no official entity for regulation, it can make the system ripe for fraud. Staying safe. While a global vaccination effort is underway, that countries should maximize their efforts to vaccinate as many people as possible while assessing the efficacy against emerging variants and adjusting as needed. There is limited research on how the current COVID-19 vaccines hold up against the documented variants. Because there is also limited data on the duration of immunity on current COVID-19 vaccines, the importance of continuing to practice social distancing, mask wearing, and handwashing until more information and data becomes available. Vaccine passports are electronic or paper passes that display a person's vaccination status. Currently, vaccine passports are not offered by an official U.S. government entity and are only offered through private organizations. Experts explain that vaccine passports may create unnecessary barriers for folks who can't access vaccinations readily, especially those living in countries outside the U.S. When can I travel again after being fully vaccinated? With vaccines being distributed across the country rapidly and summer around the corner, many are wondering when they can return to traveling. The Centers for Disease Control and Prevention, CDC, released travel guidelines stating that fully vaccinated people can now travel without getting tested or quarantining. It takes time after receiving your vaccine to be fully vaccinated. You are considered fully vaccinated 2 weeks after your second dose of the Pfizer or Moderna vaccines or 2 weeks after your single-dose Johnson & Johnson shot. While the vaccines offer a high level of immunity, there are still some caveats to traveling domestically and internationally. We asked infectious disease experts to unpack the risks of traveling after being fully vaccinated, and how you can stay safe while on vacation. Because of differing vaccination rates around the world and the potential spread of new COVID-19 variants, the CDC provided the following guidance for those considering international travel. Fully vaccinated people can travel internationally without getting a COVID-19 test beforehand unless it is required by the international destination. Fully vaccinated people do not need to self-quarantine after returning to the United States, unless required by a state or local jurisdiction. Fully vaccinated people must still have a negative COVID-19 test result before they board a flight to the United States and get a COVID-19 test 3 to 5 days after returning from international travel. Fully vaccinated people should continue to take COVID-19 precautions while traveling internationally. Travel considerations. Before deciding to embark on your travels, there are a few considerations experts say you should take into account. Possibility for infection. Despite the high immunity levels offered by the vaccines, that fully vaccinated people can still infect others and also experience symptoms of COVID-19 if they become infected. Travelers run the risk of being a transmitter of the virus to others and also still run the risk of mild to moderate disease themselves. While the FDA-approved vaccines are effective in preventing death and severe illness from COVID-19, it is still possible to contract the virus and possibly infect others who have not been fully vaccinated. None of the vaccines offer 100% immunity from the virus. There is still a risk that you could transmit the virus to others, so you have to consider the vaccination status of your co-travelers and those you will be interacting with at your destination. Infecting others. Fully vaccinated people still run the risk of infecting others. The importance of considering the vaccination status of others prior to travel, especially communities in other countries. The U.S. has made significant headway in vaccinating our most vulnerable, but many other countries lag behind, so visiting a country where the most vulnerable are not yet immune may make travel there risky. Considering these risks, domestic travel as a whole will be much safer than international travel. We need to consider the risk of those we are visiting in addition to our own personal health risks. Virus variants. Another factor that makes international travel trickier to navigate is the COVID-19 variants. The variants are more transmissible and aggressive. The vaccines approved in the U.S. seem to offer protection against the variants, but the risk of further mutations given more spread could mean new variants arise that could escape the vaccine protection. We all desire to regain our freedom to travel. We will be able to do this once the majority of people are vaccinated and the virus is contained. If you've been fully vaccinated, the CDC says you can travel domestically without a need for COVID-19 tests and quarantining. If you're looking to plan a summer vacation, consider a domestic location where mask wearing and social distancing will be possible. Safety by mode of travel. The safety of your travel will depend on your mode of transportation and other factors including the proximity to others, duration of exposure, airflow, and the ability to wear a mask. The safety of each should be evaluated by the ability to maintain social distancing and mask wearing, down to proximity to other travelers who may or may not be vaccinated, and airflow and purification. For air travel, research has shown that the cabin of a typical aircraft has air filtration systems that replace the air of the cabin every 2 to 3 minutes. The recirculated air passes through filters called HEPA filters, which remove over 99.97% of particles that are 0.3 micrometers or larger and have been found to be efficient at removing particles at 0.01 micrometers. The size of the virus that causes COVID-19 is smaller than 0.125 micrometers. This filtration process has become critical in managing the spread of COVID-19. But the safety of air travel also depends on other passengers and whether they are wearing masks and practicing social distancing. Staff and whether they are masked and practicing social distancing. COVID-19 test results for both passengers and aircraft crew, aircraft cleaning and disinfection, reduced cabin services such as food and drinks. Less research has been conducted about the safety of travel on buses and trains. But because their ventilation and airflow systems are not as robust as on a plane, the risk is likely to be higher. If taking public transport, it's best to keep the windows open, wear a double mask, and sit diagonally to the driver in the back seat. As the world takes on mass vaccination efforts, global travel will soon be seen in high numbers again. Vaccine passports, or formal certifications of vaccination, are being suggested as an accountability measure for safe travel. But they've sparked debate because they may also create a societal divide between those who are vaccinated and those who are not. The distribution of the COVID-19 vaccine is not equal. Global shortages can further widen the gap created by already existing inequalities among countries and communities. Until there are no vaccine accessibility issues, vaccine passports will likely only deepen this divide. Public health efforts should focus on community involvement and building trust in the efficacy of the vaccine. If you do decide to travel, you should thoroughly research local COVID-19 guidance for the planned destination and understand all guidelines that will impact your journey. Anyone traveling, regardless of destination or mode of transit, should also continue to exercise all COVID-19 public health measures, such as mask wearing and social distancing and hand washing. Please like, share and subscribe to my channel. Thank you for watching. See you on my next video. Ma salama.